Hello everyone. Let's start our today's topic, that is the cohort study. Population at risk for the disease events is followed over time for the occurrence of disease and events. This study used to estimate how often disease or life events happen in certain populations. These are the best method for determining the incidence and natural history of conditions. Study study of two types, that is prospective and retrospective. In that first is a prospective. A group of people is chosen who do not have the outcomes of interest, for example myocardial infarction. The investor then measures a variety of variables that might be relevant to the development of the conditions. Next is a retrospective. These use data already collected for other purposes. The methodology is the same, but the study is performed. Outcome is already developed. In prospective, studies carries out from present time to future and can be tailored to the collect specific exposure rate, but long wait for events to occur, expensive and prone to high dropout rates. In retrospective, look at the medical events from the past to present. Information is available immediately. Difficulty in tracing subject and doubt on the quality of recorded information. Well, next is what is a cross-sectional study. In that, it is a type of observational studies that are primarily used to determine the prevalence. Prevalence is equal to the number of cases in the populations at the given point in the time. All the measurements on each person are made at one point in time. Cohort study and cross-sectional study, in that difference is the study group and common measures. Study group is a population at a risk and the cross-sectional is the entire populations. Common measures in a cohort study is a risk and rate, and in a cross-sectional, that is prevalence. How to calculate the prevalence? The prevalence of health outcomes is simply the proportion of individual with the health outcomes in the populations, and prevalence is equal to case divided by total populations. What is a case control study? An observational study that compares patients who have a disease or outcomes of interest with patients who do not have the disease or outcomes, and look back retrospective to compare how frequently the exposure to risk factor is present in each groups. What are the key points? First is the case control studies are usually retrospective. In the study, the only outcomes is the presence or absence of a disease, or whatever criteria was chosen to select the cases, and aim to identify the predictors of an outcomes, and permit assessment of the influence of a predictors on the outcomes via calculation of an odd ratios, and can only look at the one's outcome. Next is what are the advantages and disadvantages. First advantages are efficient and save time and energy. Used for rare diseases, small sample size, and can generate a hypothesis for future study. Susceptible to bias record reporting, and prone to methodological errors, and selection of appropriate comparison group may be difficult. So this is all about the cohort study and case control study.